Welcome, guys. I will try to cover spore forming organisms in 30 to 45 minutes. I will just explain the basics on how to read some important points in this section. Let's get started. So first, spore forming organisms. So grossly it is of two types, bacillus and clostridium. And one first difference between bacillus and clostridium is bacillus is, as you know, it's an obligate aerobe, whereas clostridium is an obligate anaerobe. And also bacillus, it has B, so it is non-bulging spores, whereas clostridium, it doesn't have B, so it is bulging spores. And then starting with bacillus, so bacillus, it is the most common lab contaminant of the culture media. And then coming to the species, Bacillus anthracis, Bacillus cereus, Bacillus stereothermophilus, Bacillus subtilis, Bacillus pumilis, Bacillus globigii. I will discuss in detail about Bacillus anthracis and Bacillus cereus, and a few one-liners about other species are as follows. Bacillus stereothermophilus, control for autoclave, and Bacillus subtilis, it's for control for hot air oven. So stereothermophilus, so something to do with sterilization procedure. So it is used as a control for plasma sterilization and also as a control for autoclave. Whereas subtilis is hot air oven. Many students tend to make this mistake going for hot air oven for stereothermophilus, but it is Bacillus subtilis is for hot air oven. Okay, so that is the thing. That is the thing here. And Bacillus pumilis and Bacillus globigii, it's a control for gas sterilization. And then as said, Bacillus globigii, G for gas sterilization, so it is used as a control for gas sterilization. Bacillus pumilis, it's used as a control for ionizing radiation. Okay. Then Bacillus anthracis, first important species, it's in zoonotic cattle and sheep. It occurs in animals from soil. It can be transmitted to the humans. Skin of the animals, infected animals, and come in contact, and also through inhalation form and also in uncooked form. Rarely some organisms like stomoxys and calcitrans can transmit. Okay, so it can transmit. The species is not of that important, just you can just have it as a fact that it can be transmitted through insect bite also. The insect names are being stomoxys and calcitrans. And then coming to the Bacillus anthracis, it is a spore forming. What is the spore? The spore is an oval round, or maybe central or subterminal spore, and also non-bulging spores, as we know, never formed in animal body, formed in a culture or soil only. Then coming to the duckering. So what is duckering? Disinfection of the wool. The method by which the disinfection of the wool occurs is called as the duckering. So how it is done is this by 2% of the formaldehyde at 30 to 40 degrees Celsius for 20 minutes. In carcasses of animals, bacilli remain intact. In carcasses of animals, bacilli remain intact, and in skin it is of 2 weeks, and in carcasses of animals, the bacilli remain intact. For example, bone marrow, it resides for 1 week, and in skin it resides for 2 weeks, and also no spores are being taken from the infected animal. Okay, then it is the other one-liners around Bacillus anthracis are as: first pathogenic bacteria, it is seen under a microscope. First pathogenic bacteria, live attenuated vaccine is made, and first pathogenic bacteria is isolated in the pure culture, and the largest pathogenic bacterium. So because of the pathogenic bacterium, many one-liners are here, and it is seen under bacteria, live attenuated vaccine, isolated in pure culture, and it is the largest pathogenic bacterium, and category A, bioterrorism agent. Then coming to the virulence factor, capsule and anthrax toxin, both are plasmid coded. It is an important question. And fox plasmid, PXO2 plasmid. and PXO1 plasmid, FOX1 and FOX2 plasmid. It is a plasmid coded, and loss of plasmid which means a loss of virulence, useful in making vaccine. The vaccine for bacillus is the Stern vaccine. Then coming to the virulence factors, capsule polypeptide made of polyglutamate, polypeptide, it is the capsule here. Then coming to the anthrax vaccine, it is a tripartite vaccine. Remember, a diphtheria toxin, it is a bipartite. Okay, it is tri here, there is bi here. I will just explain when we deal with diphtheria. And anthrax toxin, it is a tripartite. It increases the CAMP, so edema factor, and also protective factor. It decreases the attachment of the immune cells to the organism, and also the lethal factor. So tripartite, three factors are there: edema factor, protective factor, lethal factor. Edema factor increases CAMP, protective factor decreases attachment, lethal factor increases death of the host cells. Then a zoonotic disease pathogenesis, when it is transmitted into humans, it presents as the cutaneous, inhalational, ingestion forms. Cutaneous is the most common form. Then cutaneous anthrax, it is also called as the hide porous disease. It is because of the carrying hides and skin on bareback of the infected and infected animals by the humans. And the presentation, it is the most common anthrax, and presentation is the malignant pustule. How that pustule comes, first a papule develops, and then it develops into pustule plus blood, and eschar is there. Eschar is nothing but a black lesion, and anthrax means cold, so black eschar. Okay, remember it that way. Then coming to the cutaneous anthrax, pulmonary anthrax, and intestinal anthrax. So cutaneous anthrax, as discussed, it is also called as hide walker's disease or hide porous, malignant pustule, eschar, black. Whereas pulmonary, so pulmonary something that has been inhaled, so that is wool sorter's disease. Okay, wool sorter's disease, so it is inhaled. So what it causes? It is hemorrhagic pneumonia, most commonly associated with bioterrorism. So bioterrorism agent is not cutaneous anthrax. Students tend to make mistake here, and it is the most common form, so it will think that cutaneous anthrax is the most common bioterrorism form, but it is the other way around. It is pulmonary anthrax which causes hemorrhagic pneumonia. It is most commonly associated with the bioterrorism. Then coming to the intestinal anthrax, so hemorrhagic enteritis, so something there we have ingested, so that is due to uncooked meat. Then coming to the complications, so what are the complications it can occur? Main thing, it is an encapsulated organism, so it can go into the CNS and cause meningitis and meningoencephalitis, and also the hemorrhage presentation will be hemorrhagic meningitis only, hemorrhagic pneumonia in case of inhaled form. Okay, then coming to the lab diagnosis, so the specimen is nothing but local specimen only, skin, blood, CSF, sputum, stool. Animal never perform autopsy, okay, because it is highly infectious and never perform autopsy. So blood sample or maybe the cut ear of the animal can be taken, and it is taken to the lab, and it is stored in a biosafety 2 and 3 cabinet. It is an important question here. So the specimens are stored in biosafety 2 and 3 cabinet. Then on microscopic examination, by a bamboo stick or boxcar appearance is seen, and McFadden's reaction is shown by this bacillus. So smear, what is McFadden's reaction? Smear plus polychromethylene blue, it gives a purple material around the bacilli, that is demonstrate the capsular material. Okay, so McFadden's bamboo, first during microscopy we will first demonstrate a bamboo stick or maybe the boxcar appearance, and then McFadden's reaction. So what is McFadden reaction? A smear is made, and polychromethylene blue is added, and a purple material around the bacilli. It demonstrates the capsular material. So as discussed, the McFadden reaction, bamboo stick or boxcar appearance. Another thing is that some species have documented to show Sudan black positivity in some, because of the presence of fat globules, Sudan black. So remember eschar black and Sudan black. Okay, And then coming to the culture, and what we saw is microscopic examination, McFadden's reaction, Sudan black positivity. Then coming to the culture, so agar, it is the frosted glass appearance. In agar, frosted glass appearance is seen. So what is the frosted glass appearance is that edge of the colony at low power shows a long interlacing bacilli. The edge of the colony at low power shows long interlacing bacteria, bacilli, medusa head appearance. Okay, medusa, it is like an multiple octopusic head with the multiple tentacles. This is a woman. You can just Google the image of her head. And penicillin agar, string of pearls, and gelatin stab inverted fir appearance is seen. And selective media PLET media. Okay, then coming to revising the culture, agar, in agar plate we demonstrate frosted glass appearance. So edge of the colony at low power shows long interlacing bacilli, and it shows the medusa head appearance, classical medusa head appearance. Penicillin agar, string of pearls, gelatin staph inverted fir, and selective media PLET, polymyxin lysosome EDTA, thallus acetate medium. Then coming to the serology, it is the Ascoli ring thermoprecipitant test to see antigen in the tissue. Usually in serology we demonstrate antibody, but here we see antigen in the tissue. And serology, so it is antigen, so it is Ascoli ring thermoprecipitation test is the test here. And it is a direct immunofluorescence test. It is a direct immunofluorescence test. Just remember DFA, and it is for the capsule staining, and also ELISA and can also be used. So in culture, what we saw about frosted glass appearance and medusa head appearance, penicillin agar, string of pearl appearance, gelatin stab inverted fir appearance, selective media PLET media, and its serology Ascoli ring thermoprecipitation test for the demonstration of the antigen in the tissue, and DFA direct fluorescent antibody for capsule staining and for the ELISA. And for the spores can be demonstrated by Ashby stain and with zinc and medusa head appearance. And then agar. So in agar, when we add 0.05 to 0.50 units per ml of penicillin, the cells become spherical in shape. They appears like a string of pearls. So that is called as the spherical string of pearls appearance, penicillin. So penicillin, because it doesn't affect the growth of the bacillus organisms, whereas it affects the growth of all other organisms. So we use this penicillin here, and to increase the culture sensitivity of the bacillus organisms. And coming to the gelatin liquefaction, so gelatin liquefaction is nothing but oxygen dependent liquefaction reaction. So because of the increased concentration in the oxygen, because of the difference in concentration between the upper and lower surface, inverted fir appearance is formed. Inverted fir appearance in bacillus, it is downward arrow, whereas in clostridium it is the upper arrow. Just remember that. Okay, that is a difference, and many people tend to make mistake. And coming to the lab diagnosis, gram positive, gram stain, we get bamboo stick appearance. In agar plate we have medusa head appearance, gelatin stab we have inverted fir appearance. And inverted fir, always read about bamboo. So bamboo, it's directed towards the ground, so it's gelatin fir is also directed downwards. And solid media with the penicillin, string of pearls appearance, where the box of car or maybe boxcar appearance, or maybe a bamboo stick is converted into pearl like shape. And selective media is PLET. Can you remember PLET, polymyxin lysosome EDTA? Yes, that is the thing. EDTA, thallus acetate medium. And coming to the blood agar is it's non-hemolytic, whereas Bacillus anthrax is non-hemolytic, whereas other bacillus are hemolytic. Okay, and then CDC guidelines. What does it say? After USA bioterrorism attack in 2001, it is said that any gram-positive bacillus, when it is non-motile, non-hemolytic, and it is catalase positive, just don't wait for the culture sensitivity. Just give a presumptive diagnosis of an anthrax and issue reports to the respective government agents. Okay, it is because of precautionary measures after the bioterrorism attack in 2001. And coming to the biosafety, sanitation of the factory must be ensured, and animals died of anthrax, no autopsy. Okay, even it is dead or alive, no autopsy should be performed, and it will be buried deeply in a quicklime. into the soil, or maybe it's better to cremate to prevent soil contamination. And coming to the immunization, it is the Ava Biothrax. Okay, it is an anthrax vaccine adsorbed. Ava Biothrax, it is a human vaccine. Okay, Ava Biothrax. And uh, who are given this kind of immunization? It's veterinarians and occupational exposure risk people are maybe given that. Pre-exposure and post-exposure vaccines can be given. And animals, pasture anthrax vaccines, stem cell vaccines for the spores. Okay, stern cell, I have just said that. Just remember, for the spores, yes, stern, yes. Okay, S for S, stern, stern, and the spores. And Mazuchi vaccine for the Carbazo strain is it Carbazo Mazuchi. Okay, and then coming to the treatment of uncomplicated cutaneous anthrax, it is the fluoroquinolone or doxycycline 7 to 14 days. In case of systemic anthrax, add and that is other two forms like ingested or inhaled form, add antitoxin to like anthracis human immunoglobulin or roxibacumab or oblitoxazimab. Okay, oblitoxazimab or maybe roxibacumab, oblitoxazimab. Okay, then bacillus anthrax meningitis. I said now it is catalase positive and also encapsulated, so 60-day antibiotic, at least 3 antibiotics including clindamycin has to be given and should be covered for 60 days. And post exposure prophylaxis, it is for by given with the Ava Biothrax, it is a human immunoglobulin. Ava Biothrax, it is a human anthrax vaccine adsorbed type of anthrax vaccine. It is given along with 60-day antibiotic coverage. And anthracoid bacilli, few questions have come under the topic, and it's just 2 or 3 lines, and but it is very very important. Anthracoid bacilli, and we have seen that Bacillus anthracis, it is an obligative aerobe, it is also aerobe. Okay, that is only one thing similar here, other everything is different. It has a rapid gelatin liquefaction, no inverted free appearance in case of anthracoid or maybe pseudo anthrax. It is a rapid gelatin liquefaction, it is a non-pathogenic, and it is an motile, and it is a non-capsulated, and it doesn't show no medulla head, no string of pearls, no, and it is in hemolytic. As I have said, only Bacillus anthrax is non-hemolytic, other organisms under Bacillus is hemolytic. Okay, but only one common, though it is in pseudo anthrax, only one common point between Bacillus anthrax and Bacillus pseudo anthrax, it both forms supports aerobic growth only, and it forms pseudo anthrax form rapid gelatin liquefaction, and our Bacillus anthrax forms inverted filthy appearance. That remove bamboo stick, so bamboo stick is deep rooted in the ground, so downward direction. Upward direction is for Clostridium. And then coming to the Bacillus cereus. So what is Bacillus cereus? It is a normal inhabitant of the soil. Food items like milk, veggies and cereals are usually contain this organism. Bacillus anthracis. So first remember, Bacillus anthracis means food poisoning. So types, it can be a diarrheal type or maybe the emetic type. Emetic type, it is due to the cerulide vagal it causes vagal stimulation similar to staph enterotoxin. Okay, cerulide, just remember cerulide, CERULIDE. And then in a diarrheal type we have NHE, non-hemorrhagic toxin, secreted diarrhea, ETEC, Clostridium perfringens. Okay, everything produces diarrheal type. And whereas the emetic type, as I've said, it is due to the cerulide, it causes the vagal stimulation due to staph enterotoxin. And then diarrheal type 8 to 16 hours, it is usually following a meat and veggie food consumption. Serotype is 2, 6, 8, 9, 10, 12. Okay, 2, 6, 8, 9, 10, 12. Relatively everything is in multiples of 10, only 9 in between. And this is also diarrheal type, the incubation period is also 8 to 16, so it's a multiple of 2 only. Whereas in emetic form, so emetic Though Staph aureus also causes an emetic form of food poisoning, it is 1 to 6 hours only. It also 1 to 6 hours, but classical emetic form, usually the history will show Chinese food consumption or fried rice consumption. Okay, and the serotype is in just remember the odd numbers 1, 3, 5. Even numbers for the diarrheal type. Okay, diarrhea is even, emetic is odd, 1, 3, 5 here, and there only 9 is extra. Otherwise one are the same. It's 2, 6, 8, 10, 12 and 9. And then lab diagnosis of Bacillus cereasis, it is opposite to Bacillus anthrax, so it is motile on, and it is a non-motile, non-encapsulated, and selective media. The growth, when the organism grows more than 10 power 5, is diagnostic. And MYPA is the agar mannitol yolk polymyxin agar. MYPA and Pemba agar. Mannitol yolk polymyxin agar, Pemba agar, polymyxin, mannitol, bromothymol blue that we use in cled medium for to check fermentation, lactose fermentation, right? The same bromothymol blue is used here. And polymyxin and mannitol is very similar for both MIPA and Pemba. Okay, Timon and Pumba, MIPA, Pemba. Okay. Then coming to the Bacillus thuringiensis, it is a larvicidal agent. Okay, larvicidal agent for mosquito control. And then this is it for Bacillus. And coming to the Clostridium, and then Clostridium, as I have said, it is an obligate. Coming to the first point, it is a bulging spore, and it is an obligate anaerobe here. Bacillus is an aerobe, it is an anaerobe, both are gram positive bacilli only. Then coming to the most common subterminal spores, except most common is the subterminal form among Clostridium, but except tetani, tertium and bifermentans. Okay, bifermentans. Okay, Clostridium tetani, Clostridium tertium and Clostridium bifermentans. These doesn't produce subterminal spores. It produces different spores. I will just explain later. Just remember that these three are the exceptions here, and exceptions are always questions. So most common subterminal spores, and the exceptions are the Clostridium tetani, Clostridium tertium and Clostridium bifermentans. Then coming to the most common subterminal spores, except we saw that Clostridium tetani, TE. So any organism which has TE or maybe BI, it's terminal only. TE, terminal spores. TE, terminal spores. BI, we have to divide into two. It is central spore. Okay, terminal spore, it is a drumstick appearance. Okay, D comes first, or maybe just have that a drumstick has tetany. So tertium is a tennis player. Okay, tertium, tennis racket appearance, terminal spore, it is an oval spore, whereas tetany is a round spore, drumstick appearance. So drumstick, round spore, Clostridium tetani, terminal spore. Tennis racket appearance, Clostridium tertium, it is an oval terminal spore. And Clostridium bifermentas, it is a central spore. Okay, bicentral spore, and it is mostly unencapsulated only, except Clostridium perfringens and Clostridium butyricum. And remember these mostly unencapsulated, but Bacillus is encapsulated, right? So it is unencapsulated only. But the exceptions are Clostridium perfringens and butyricum. So just remember PCB. Okay, physics, chemistry, biology. So physics, chemistry, biology. So CP, perfringens, butyricum, both are not capsulated, and everything is motile, but exceptions are perfringens again. Okay, PMT, tetany, T for tetany. So these are non-motile, everything is motile. Then first coming to the Clostridium perfringens, earlier it was called as Clostridium welchi. Okay, earlier it is called as a Clostridium welchi, and Clostridium perfringens, it is in commensal. So briefing it out, it is in gram positive bacilli, accepted. It is capsulated, accepted. Just remember this PCB, it is capsulated, accepted. Okay, whereas non-motile, okay, it is non-motile, but it is capsulated, gram positive, accepted. And subterminal spores, yes, accepted, because it doesn't have T only terminals. BI, bifermentans, it is only central. And the Clostridium perfringens, coming to the virulence factor, It produces a heat labile enterotoxin, or maybe the invasive or the toxigenic forms can be produced. Okay. Yeah, so yes, the Clostridium perfringens, it is an commensal, it is a non-model capsulated gram-positive bacilli, and it produces subterminal spores. And coming to the virulence factors, so the virulence factors, it is an invasive and toxin producing Clostridium perfringens, 4 major toxins and 8 minor toxins. Just cram the names, and you will just pick it up in the questions. 4 major toxins, it's alpha, beta, epsilon and I. Lecithinase and phospholipase activity is shown by alpha. So alpha is the prime or main thing, so it gives lecithinase and phospholipase C activity. And the soluble substrates, it shows neuraminidase or maybe histaminidase activity. Okay, so these are the 4 enzyme activities shown by the toxins. Soluble substrate shows neuraminidase and histaminidase, whereas the 4 major toxin alpha, beta, epsilon and I produces major toxins, out of which the alpha produces lecithinase and phospholipase C. And coming to the 8 minor toxins, so 8 minor toxins are the gamma, kappa, theta, mu, delta, lambda, eta, nu. Okay, gamma, kappa, theta, mu, delta, lambda, eta, nu. Okay, just have this name and just go through the symbols once, because it will become more confusing in the examinations. And then coming to the Clostridium perfringens, it has bursting factor or maybe circulating factor. So bursting factor, as the name indicates, it acts on muscles and produces the gas gangrene. And the circulating factor, as it is in the circulation, it inhibits the phagocytosis. It is the maximum it can do. And Clostridium perfringens, coming to the clinical features, first thing, wound infection. So simple wound contamination, anaerobic cellulitis and anaerobic myositis. Okay, because of the bursting factor, it acts on the muscles and it produces anaerobic myositis and further leading to the gas gangrene. And coming to the gas gangrene, it is an edematous myonecrosis associated with an severely crushed wound. So the crushed wound is responsible for maintaining the low oxygen temperature, low oxygen environment, and that results in the, and when it is contaminated with Clostridium perfringens, it can grow in that medium. And lecithinase produced by the alpha toxin, it damages the cell membranes, it increases the capillary permeability, and it is also hemolytic, and it increases the tension in the muscles, and further anoxia achieved by alpha toxin. So alpha toxin, one of the 4 major main group of toxin. And okay, so alpha is the main thing, it has lecithinase and phospholipase C activity. Because of that reason, it damages the cell wall, and it also hemolytic, it breaks RBC, and hemoglobinuria is seen. Okay, hemoglobinuria. And then coming to the Clostridium perfringens, most common presentation is the most common glass gangrene is caused by 60% of the cases is caused by Clostridium perfringens. Others like Clostridium septicum causes 22, second most common, and Clostridium novae. Just remember the names, Clostridium septicum and Clostridium novae. And coming to the incubation period, and the incubation period is Clostridium perfringens is 10 to 48 hours, Clostridium septicum is 2 to 3 days. Just remember Clostridium perfringens less than 2 days. Okay, Clostridium septicum is 2 to 3 days, and Clostridium novae, it's a type A form of Clostridium novae, is 5 to 6 days. Okay, and then one previous question asked is Clostridium septicum, it is not in humans, in brachy sheep edema. Okay, in this sheep only it causes edema. In cattle and sheep, brachy sheep edema, cattle sheep. Okay, type A form of Clostridium novae 5 to 6 days, whereas Clostridium septicum is 2 to 3 days, and Clostridium perfringens is 10 to 48 days. 10 to 48 hours, less than 2 days. Coming to the pathogenesis, it requires an anaerobic environment, it requires the contamination of the wound by the Clostridium perfringens, and it is rarely. And can you say the spores produced by the Clostridium species? Yes, bulging spores, very good, and rarely spontaneous. Okay, pain, discharge, gas bubbles, crepitus, classical feature of a gas gangrene, and shock is seen. And coming to the enteric infection, food poisoning, heat labile toxin, enterotoxin due to cold and or warmed up meat, gangrenous appendicitis type A, Okay, appendicitis A, type A. Necrotizing enteritis, type C. Okay, necrotizing enteritis, type C. All these are previous year questions. Okay, so food poisoning, heat level toxin, enterotoxin, gas gangrene. Gangrene is appendicitis A, type A. Necrotizing enteritis, it's type C. And pig bell, abdominal pain and diarrhea following feast with pig meat plus sweet potatoes. Pig bell. So pig bell, Clostridium perfringens, enteric infection, enterotoxin. Okay, food poisoning. Lab diagnosis: specimen, necrotic tissue is taken and examined. Muscle fragments, myositis, gas gangrene is also taken and examined. So what is the structure seen here? It is the brick shaped gram positive bacilli. Can you remember the bamboo stick appearance or maybe the boxcar appearance? Yes, it is in the Clostridium perfringens. And here it this Clostridium tatani. So Clostridium, are you sure? Isn't it Bacillus anthrax? Yes, it is Bacillus anthrax. So Clostridium perfringens, it is the citron body. Citron body is seen. And citron body. Citron is a car. So brick also shape of a car. So car perfringens, car, citron, brick, gram positive bacilli. And Clostridium, then what is the second most common organism? Is the Clostridium septicum. Then what is the septicum shape? It is the boat. It is the car, citron brick for the perfringens and boat leaf for the septicum. It is second most common for gas gangrene. And coming to the media is the Robertson cooked meat broth, red color, RR, saccharolatic growth, not a proteolytic. Proteolytic is in white color growth, or maybe a fluffy or white color growth. And this saccharolatic is the red color growth in the Robertson cooked meat media by the Clostridium perfringens species. And target hemolysis is seen, and a nucleus reaction is demonstrated positive, and a stormy clot formation on litmus milk test. Okay. Reverse cam test positive. Stormy clot formation on litmus milk test. Okay, and then coming to the nucleus reaction. Nucleus reaction. What is nucleus reaction? I already said that the main toxin is the alpha toxin lecithinase activity and phospholipase C activity. So that is responsible for the nucleus reaction. So opalescence surrounding the streak line of egg yolk agar, that is the lecithin. So lecithinase surrounding by the action of lecithinase inhibited by adding an anti-alpha toxin. So it is demonstrated. Okay. Nager plate, it contains egg yolk agar. It is broken by formation of opacity is seen. Opacity is by the lecithinase activity exhibited by the alpha toxin. Because of this reason, when anti-alpha is added, it is counteracted. Then the target hemolysis, double zone of hemolysis, Clostridium perfringens, double zone of hemolysis. Okay. Double zone of hemolysis. Okay, and then we know that in what is I already said one thing, a reverse cam test I said now. But then what is cam test? Cam test means it is used to demonstrate growth of narrow head colonies in Streptococcus galacticus. It also produces a linear growth by staph aureus. Then what does reverse cam test do? So reverse cam test, what does it mean? When a Clostridium perfringens, when the arrowhead is inoculated by the staph galacticus. Okay, then the linear growth is produced by the Clostridium perfringens. So we are confirming the growth of Clostridium perfringens by before inoculating the cam plate with staph agalaxia. Okay, so that is the reason for that we call it as reverse cam test. Then coming to the litmus milk test, what are we testing here? So milk. So we are testing the fermentation of the lactose. So lactose acid is an acid. Okay, so we know that acid turns blue litmus, red is for acid. So it coagulates case in the milk and it produces gas production. So that is responsible for a stormy clot formation. Okay, and what is the treatment for surgical debridement gas gangrene? Obviously an antibody treatment. Yes, passive immunization, anti-gangrene serum given 10,000 International units IM. If emergency, IV. Usually all the antitoxins are given IM only. In emergency only IV is given. For Clostridium septicum 5000. Okay, IV. Okay, IV. Then Clostridium tetani. So what is the key points in Clostridium perfringens? We have seen that up to pathogenesis you can say, and you can even remember the toxins too, because it is a clumpy number. Other features you can remember easily, but coming to the lab diagnosis, it becomes complicated stuff. Brick shaped colony, gram positive bacilli, citron body, Clostridium septicum, boat shaped, leaf shaped, Robertson cooked meat broth, red color saccharolytic growth, target hemolysis, double zone hemolysis, Naegler's reaction, litmus milk test, reverse cam test positive. Okay, these are the few tests under Clostridium perfringens, which is making appear like a bit complicated, but it is simple only. Then coming to the Clostridium tetani. So Clostridium tetani, it's not simple. Tetanus, two toxins only, not a big toxins, tetanolysin and tetanospasmin. Tetanolysin, hemolysin, no role, oxygen label L, just remember it that way. Okay, tetanospasmin T, so it is stable T, and main role oxygen stable only, and both toxins are heat labile only. Okay, so oxygen stable is tetanospasmin, tetano-TT, tetanolysin, hemolysin no role, heat hemolysis no role. Then what is tetanospasmin do? It is a neurotoxin. Okay, accepted. Acts presynaptically at the inhibitory neuron terminal. Okay, then what does it do? It prevents the release of GABA and glycine. It is an inhibited neurotransmitter. When it is not released, the excitatory neurotransmitter level is increased, so it produces muscle contraction. So how does the patient present with the uncontrolled spasm? Okay, so presynaptic action, spasm. Okay, and is there any other poisoning acting similarly, or maybe the clinical presentation is kind of similar to this thing? It is this tight chain poisoning, and it produces the same effect, but here the difference is the postsynaptic blockage. Okay, and coming to the Clostridium tetani transmission, the transmission is mainly by the injury and injury site contact with an unsterile area, RTA, no person to person transmission. In Clostridium tetani, clinical features: incubation period is 6 to 10 days, a shorter incubation period. Was first symptom trismus or the lockjaw. It is the first symptom. It is an important, very favorite question. And then a neonatal tetanus. Okay, so I will just explain about neonatal tetanus later. And then coming to the clinical features with the progression. So jaw spasm, limb spasm, descending spastic paralysis, deep tendon reflexes increased, autonomic disturbances. In second week there is an increase in BP, not decrease in BP, increase in BP, increase in pulse rate, and increase in sweating. Okay, now usually people think, students tend to make a mistake that second week the situation becomes worse, so they will enter into shock, so they will come that BP falls, pulse rate falls, so like that they will say, but it is just the autonomic disturbance here. So that is the point you have to note there. And coming to the complication is the rhizus sardonicus and fifth tonus position. Okay, then a specimen is the necrotic tissue, gram positive bacilli. Okay, drumstick appearance. Can you remember any more drumstick appearance here? Yes, Clostridium tetani. This only we studied there only. Okay, Clostridium tetani. Drumstick appearance. Terminal spores. Very good. Yes, terminal spores. Then gelatin stab. It's the plain fir tree. Okay, plain fir tree and no inverted fir. Inverted fir is there. Plain fir Clostridium, as I have said, it goes up. Patient goes up, so fir up direction. And a Robertson cooked meat broth, it is a black colored medium. Okay, then what is perfringens? It's pink color. Or maybe it is a red color. It is saccharolytic. Here it is black. Then coming to the proteolytic, there also no, there is a red one. Is sure? Yes, I think I got confused here. It's saccharolytic red only, and here it's black. Okay, then coming to the blood agar, first alpha hemolysis and then to the beta hemolysis. Only here we will see this kind of hemolysis after first alpha hemolysis, then entering into the beta hemolysis and due to hemolysin. And if you're interested, just to remember field days technique. And prevention is by the passive immunization. So human tetanus immunoglobulin 250 international units, anti-tetanus serum 1500 international units. It side effect, it produces type 3 hypersensitivity reaction. All vaccines type 3 hypersensitivity. So what is preferred? Human tetanus immunoglobulin is preferred. Anti-tetanus serum is more dose, so not preferred. Then coming to the treatment, passive immunization versus active immunization if previously vaccinated. Vaccination is the monovalent TT, combined TT. Child immunization schedule 6 weeks, 10 weeks, 14 weeks. 6 weeks, 10 weeks, 14 weeks. Then coming to the 16 to 24 months and 5 years, we give DPT, and 10 years, 16 years tetanus toxoid. And for the girls, antenatally 2 doses antenatal given. And adults first dose of TT within 1 month or 4 weeks gap, second dose of TT, and then within 1 year third dose, and maybe 10 years after another dose. Okay. And prevention, 8th day disease, neonatal tetanus. It's also called as the 8th day disease because usually the baby don't cry after D2 to D8. Most common reason is the neonatal tetanus. Prevention, so someone clean hand, clean blade, clean towel, clean water, clean surface cord, clean cord tie, clean cord stamp, plus a tetanus toxin, 2 doses is given to the mother antenatally. Then Clostridium botulinum, virulence factors, botulinum toxin, most toxic substance known to be lethal to humankind. Okay, accepted. Botulinum toxin serotype. So serotype is 8 serotype. Clostridium tetani 2 we saw, many we saw for Clostridium perfringens, big name many. So botulinum we see 8, B looks like 8. So it's A, B, C1, C2, D, E, F, G, and A, B, E affects human, and A is more severe, and phage coded C1, C2, and D. And all produces a neurotoxin. Okay, neurotoxin, it is C2 produces, except C2 produces enterotoxin, C1, C2D are phage coated. Then coming to the botulinum, virulence factor, virulence toxin produces intracellularly appears in medium only on cell death or autolysis, released as a protoxin, acted by trypsin. Here also botulinum lethal, no, so it is pro only. It is converted by trypsin into activated form. It blocks ACH releases, so it causes flaccid paralysis. Okay, there it is an ascending limb paralysis, here flaccid paralysis. These are presentation is same, but the keywords changes, right? So flaccid paralysis for botulinum, and whereas ascending limb paralysis for exaggerated treatment and reflexes for tetani. Okay, Clostridium manifestations 5D. So diplopia, dysphasia, diplopia eyes, dysphasia speech, dysarthria, articulation, descending. Okay, descending flaccid paralysis. Okay, this is what I try to mention here, and a decrease in DTR, deep and reflexes. So these are the two different differentiating points between Clostridium botulinum and Clostridium tetani. And then types of botulinum toxin, foodborne, it is canned food, especially showing bubbles on opening, and wound botulism, infant botulism, bottle fed, honey baby food, or maybe iatrogenic botulism. Infant botulism, when is a bottle fed baby, honey given, or maybe baby food given, those infant botulism. And no food considered infected with toxin rendered safe when it is pressure cooked or maybe boiled for 20 minutes. So 20 minutes is the time here. It is also a previous year question. And then diagnosis, gram positive bacilli, subterminal, oval, bulging, anaerobe. So taxoid antiserum is given. So first dose 10 weeks, 1 year. Okay, after 1 year booster, we know that ABE is the affects the human. So A is the most severe form, so we are giving against it. So it is 4 weeks for Clostridium tetani and 10 weeks for first dose and second dose difference is to 10 weeks for botulism. And coming to the Clostridium difficile, so Clostridium difficile, pseudomembranous enterocolitis, virulence factors, toxin A and toxin B. Toxin A, it is attachment to the gut, so enterotoxin. Toxin B is cytotoxin. Okay, and then pseudomembranous enterocolitis, acute colitis with bloody diarrhea. Okay, only one, but major presentation. Main risk factor is the long term use of free use of antibiotics, and pseudomembranous enterocolitis medium is the, just remember, pseudomembranous enterocolitis is Cephacea, CCFA. No one is going to ask the full form here. CCFA. Okay, CCFA: cefoxitin, cycloserine, fructose agar, cefoxitin, cysteine yeast extract agar. Colonoscopy, histopathology, and toxin is demonstrated by ELISA. You can see the pseudomembranous specimen there, and main by the free use of antibiotics, and metronidazole is the treatment. And coming to the recent advances, fecal transplant, stool from healthy donor is given to the GIT of ulcerative colitis patient, and it restores the normal flora, and it treats Clostridium difficile colitis. Okay, and by this we have just took 45 minutes, and we have just completed all the spore forming organisms, starting from the Bacillus anthracis, Bacillus cereus, Bacillus subtilis, and Bacillus and few that one-liner, that sterilization, Stereothermophilus, that organisms, and Fumilis globi. And then we entered into the discussed about Clostridium main organism is Clostridium perfringens and Clostridium tetani and Clostridium botulinum, and minor importance is of the Clostridium difficile. So main thing is Clostridium difficile. We have pseudomembranous enterocolitis, and for the booster doses, that Clostridium tetanus for 1 week, 4 week, and Clostridium botulinum it's 1 week, 10 week. And then the toxins in Clostridium perfringens is many toxin, that 4 major and 8 minor. Okay, it's a big list of toxin, a full Greek name toxin. And other group in Clostridium tetani it's 2 groups, and in Clostridium botulinum it's 8 groups. So in that we had that A, B, and E affects the human, and C1, C2, and E it's phage coded, and C1 except C2 everything is neurotoxin, whereas the C2 is an enterotoxin. So these are the few ideas you can just easily cram up, but I personally feel that during this kind of examinations it's more of an factual stuff that is being tested, that you have to have that facts in your nerves. So it only happens when you have a thorough grip over the subject. You have to just limit yourself to a few sources of information, but few high yield sources of information, and you have to repeatedly go again and again and again and again. That's it till you reach your goal there. Okay, all the best. Thank you.